Hello, this is Tom Heston, MD from the Internet Medical Association. It is March 1st, 2013, and today I'd like to share with you some interesting research from the Cochrane collaboration on the use of antioxidants in the prevention of disease and in the treatment of established disease. So here's our overall summary of the use of antioxidant supplements. And they're looking at the prevention of mortality, that is, the prevention of death in healthy people and in people with various diseases. Just a quick word about the Cochrane collaboration. It is an independent organization, and these summaries are produced using rigorous methods by the impartial and independent Cochrane collaboration. So this is best evidence. And what their review, done March 14th last year, show that there's increased risk of mortality associated with beta-carotene and possibly vitamin E and vitamin A, but this was not associated with the use of vitamin C or selenium. The current evidence does not support the use of antioxidant supplements in the general population or in patients with various diseases. So, according to best scientific evidence, antioxidant supplements are not to be recommended for the prevention of mortality in healthy people. So let's look at their review of vitamin C supplementation for asthma. And again, from the available evidence, it is not possible to recommend either the use or avoidance of vitamin C supplements in asthma. So there's a little bit of a mixed story there. Evidence from randomized controlled trials is insufficient to recommend a specific role for vitamin C in the treatment of asthma. So there's a possibility there, but certainly nothing conclusive. Now let's look at the use of antioxidant drugs for preventing lung cancer in healthy people. And current evidence does not support recommending the use of supplements of vitamin A, C, or E, or selenium, either alone or in combination, for the prevention of cancer in healthy people. And in smokers, beta-carotene may increase the risk of lung cancer. Again, the summary, it's freely available online at cochrane.org, and this summary was produced using rigorous methods by the impartial and independent Cochrane collaboration. So let's look at the use of antioxidant vitamins and mineral supplements to prevent the development of age-related macular degeneration. And what their review found is that taking vitamin E and beta-carotene supplements is unlikely to prevent the onset of age-related macular degeneration. There is no evidence for other antioxidant supplements and commonly marketed combinations. So save your money. Again, this summary was produced using rigorous methods by the impartial, independent Cochrane collaboration. Now let's look at minerals and vitamin supplements to slow down the progression of age-related macular degeneration. That is, in people who have established macular degeneration, do antioxidant vitamins and mineral supplements seem to help. And their review actually found that supplementation with antioxidants and zinc may be of modest benefit in people with age-related macular degeneration. So there seems to be a limited role, at least in this one condition. Now let's look at cystic fibrosis, lung disease. Again, the evidence, the scientific evidence showed that quality of life actually decreased in the groups taking supplements. Antioxidant supplementation in cystic fibrosis is not yet recommended beyond routine care. And like a lot of this research, larger trials looking at important clinical effects are needed. Now finally, let's look at antioxidant supplements for liver disease. Once again, they find that antioxidant supplements cannot be recommended for the treatment of this particular disease. And again, this is in patients with established liver disease. There's no evidence to support or refute antioxidant supplements in patients with liver disease. That is, there's no evidence supporting its use, certainly no good evidence, and therefore we don't know quite what to do. If we are to practice evidence-based medicine, then we would just have to say we cannot give a recommendation of antioxidant supplements for liver disease at this point in time. So what do we draw from all of this? I think we can reasonably conclude that antioxidant supplementation is very likely to have little or no benefit in most people. Certainly in healthy people, the value of taking antioxidant supplements, according to the available research, indicates no benefit in the prevention of disease so far. Now we have to keep in mind that the lack of evidence doesn't mean that it could not be true. So absence of evidence doesn't mean evidence of absence. Just because we don't show a research trial demonstrating that, for example, vitamin C prevented a certain disease, that doesn't mean that at some point in the future there may be a study showing that vitamin C does work in the prevention of certain conditions. However, at this point in time, science and using rigorous scientific methods and objective evidence, at this point in time, we have to say that take antioxidant supplements really at your own risk, and given that there's very little evidence there, just keep that in mind. In general, what I recommend to people is that if it seems to be a benefit to them, go ahead and give it a try, but science shows no benefit. We have to keep that in mind. We may try some things, we may guess, but science does not show a benefit. And that's all for today. Save your money.